everyone, I'm Mai and welcome to our YouTube channel, The Pathfinder Couple. Today's video, we're going to talk about how to be a registered nurse here in New Zealand. I've been working as a nurse here in New Zealand for over 5 years now, and I'm inspired to make this video as some people that I knew asked me of how to be a registered nurse here. We're going to show you interviews from 3 Filipino nurses, 1 Indian national, and 1 South African charge nurse manager. So 3 of these nurses applied CAP while being in their home countries. 2 of them applied via agencies and 1 directly to the Nursing Council. And 1 Filipino nurse applied CAP while being here in New Zealand. Most importantly, we'll hear some helpful advices from my current charge nurse manager about CAP. This will be helpful for those upcoming CAP students who will undergo their CAP in a hospital setting. So I'm grateful by these people that they're willing to share their knowledge and experience during their CAP. So please watch till the end of this video because we're going to summarize the current step-by-step application to the Nursing Council as well as the tips during CAP placement. So guys, please watch my first interview with my current charge nurse manager, Lisa Campbell. Hello everyone, so we're going to interview our charge nurse. So we're going to interview her about the CAP program. So thank you for your time, Lisa.
No worries.
Would you like to introduce yourself?
Great. So I'm Lisa Campbell. I'm the charge nurse manager of an acute medical ward at a little rural hospital in Ashburton, which is in the South Island near Christchurch Hospital.
Yeah, thank you, Lisa. So just a advice to future CAP students who will have their placement in a hospital setting. So what will be your advice to them?
Well, I came from South Africa, so I sort of have a bit of experience about coming from a different country and working in New Zealand. And I think my advice to you would just be, remember it's all going to be very new and different for you. So don't be overwhelmed by that. And one thing I did notice, Marisol, is that Kiwis love to talk in abbreviations, you know, so and not just medical abbreviations, which you'd probably be familiar with, but when they talk about programs, they'll talk about PDRPs, and NetPs and DNMs, and you know, you might think, what are these people talking about? It's a whole different language. And I just, you know, encourage you to ask questions when that happens, you know, say, sorry, can you just clarify exactly what that means?
So we must not be hesitant to ask questions. And then along the way we can also learn about the Kiwi slang.
Absolutely, yes, that's great. Yeah, so even if they do use a slang word on you, just say, oh, just explain to me what that means. Yeah, and I think with everything that you do in your nursing, the language, if you come across anything that's unfamiliar to you, don't be afraid to ask, you know, rather than worry what is that or how do I do that. I think everybody's quite understanding and forgiving that you come from an environment that's slightly different. We're all different, you know. Yeah. So
we must also bear in mind that we have only I think 4 to 6 weeks to do this practical placement, so we must do our best, right?
Absolutely. I would just say, you know, don't hold back. If you know something and you see a need in the ward or something that needs to be done, use your initiative and you know, feel free to go and do that, or say to the person who's precepting you, look, I'll go and do some obs on that patient because they're due, or I remember that antibiotic is due, so I'm happy to go and give that antibiotic. So, you know, don't be afraid to step up and use your initiative, and you know, don't be afraid to share the knowledge you have, because you come with vast knowledge from your past experience. So you can add value to us as well. So we love having CAP students because we learn from you just as much as you learn from us. And as Marisol says, it is an important time because you want to do well. CAP placements often lead to jobs, and certainly having that Kiwi reference when you're applying for other jobs from the CAP program is very helpful. So
so if charge nurse will like your performance, probably she's going to hire you after your CAP.
Absolutely. If a charge nurse has a position available and she was happy with your performance, she may well say, yeah, I'd love to have you. And if she doesn't have a vacancy at the time, she'll often do you a great great reference.
True. Thank you, Lisa, for your time.
No worries.
I hope it will be helpful to you guys.
Yeah.
Thank you.
All the best. Bye.
Thank you, Lisa, for your time and for sharing your valuable advices to the upcoming CAP students. And guys, I'm going to introduce you to Ate Mimi. She's my Filipino colleague in our ward, so she is a valuable asset in our area. So yeah, let's listen to her tips about CAP. Okay. Hello everyone, so I'm with Mimi. So she's one of the nurses here in New Zealand. So we're going to ask her some few questions of how to apply Competency Assessment Program or CAP here in New Zealand. So first of all, why did you choose New Zealand?
I chose New Zealand because, well, actually it was recommended to me by my friend. She came here first for about 3 or 4 years before me. And then she was loving it and she was happy with the working conditions for nurses here. So I followed her lead.
Oh, that's good. How did you apply CAP?
I applied with the help of an agency and it was Advanced Healthcare.
Oh, that's good. Initially I applied via agency as well, but then later on, in order for me to save money, I applied it by myself.
Okay.
So you can just follow the instructions from New Zealand Nursing Council website, but then bear in mind that their guidelines are always changing.
Yeah. Definitely.
So what essential things did you bring?
I made sure to bring winter clothes, some warm shoes, a universal adapter or charger is it for cell phones and laptops, and I made sure to bring my cell phone as well, my laptop, original documents like transcript of records, IELTS certificate, and other documents that you had to submit during the application process. I made sure to bring all those just in case so that it's already handy.
Oh, okay. Yeah, I'll add something. So you need to bring your extra money as well.
Yeah. Yeah.
Yeah. So as well as driver's license if you have, because it will be very helpful for you after the CAP course.
An allowance. Yeah.
So any tips to study?
Well, you can do a bit of review with anatomy and physiology, assessments, pharmacology, and common diseases, probably just like heart disease, hypertension, diabetes. Yeah.
And as well as wound care and infection control. And you need also to study about the Maori culture here in New Zealand, because New Zealand is a diverse community. So you'll be able to, probably one of your patients is a Maori, so you need to study about their culture in dealing with them. Yeah. Okay. So can you please tell us what was your experience during the CAP course?
It was cold because, well, you know, first time to experience winter, and I came midwinter, really. It was July 2012.
Oh, okay.
Yes. And then during that course, we were a group of 9 Filipinos together. So it wasn't really a big shock or, you know, a big realization of homesickness because we were all together.
Oh, I see.
Yeah.
Oh, you're blessed, because in my case, I was the only Filipino.
Oh,
and then
okay.
I got homesick, but then I survived. Because we need to, during CAP course, we need to focus, pray, communicate with your loved ones, right?
Yes.
So that's the basics of what you're going to do during CAP course, right?
Yeah.
And how long did you get the job after CAP?
So when I finished the CAP, we waited for our registration to arrive. For about maybe after 2 weeks, I got the job, and that's when I got the chance to change or apply for a work visa.
Okay. Oh, that's pretty quick. So any additional tips for the international students who apply CAP here in New Zealand?
Okay. So if you want to come here and do the CAP and then be a New Zealand nurse, you really have to prepare yourself to be in a foreign country. So you have to prepare mentally, physically, and that's because of the climate. Well, financially, and then prepare psychologically as well. You have to be open-minded because it's a different country, a different culture. And then you also have to be assertive and receptive, especially during your course and when you are doing your placement. And then, yeah, don't forget to keep in touch with your family. Yeah.
That's the most important thing.
Yeah.
Yeah. Thank you for your time, Auntie Mimi. So hopefully you'll be able to learn something from you regarding CAP program here in So thank you, Auntie Mimi, for your sharing your knowledge and ideas during your CAP placement. And now I'm going to show you my interview with Sobin. Sobin is my colleague. He's an Indian national and he's been here in New Zealand for a few years now. So I'm sure you'll get some informative tips about CAP. Hello everyone, so I'm with Sobin.
Hi.
So he's one of the nurses here in New Zealand. So he's from India. So we're going to ask him some few questions of how to apply Competency Assessment Program here in New Zealand. So first of all, Sobin, why did you choose New Zealand?
Well, I think New Zealand is one of the most beautiful countries in the world. So, but to be honest, I never had a plan to come to New Zealand. I was looking for somewhere in the UK or in the US or in Australia, but when I started applying for those different countries, I found that the processing is getting quite complicated over there. So I ended up with either picking Australia or New Zealand. And at that point of time, I think New Zealand wanted more nurses, and it was much more easier to come over to New Zealand.
Oh, I see.
Yes.
So how did you apply CAP?
Through an agency back in India. I had a bit of a guidance from that agency, but towards the end of it, I mostly done everything by myself. So Nursing Council of New Zealand has got all the instructions on their website, so you can go through it. It's pretty much simple, straightforward. But if you are not very confident applying it by yourself, you can always go through an agent.
Yeah, I agree with you. Because initially I applied by an agency as well, but then later on I applied by myself. You can just go to Nursing Council website in New Zealand. But bear in mind that the guidelines are always changing, isn't it?
Yes. It's always good to be very up to date with the Nursing Council website, because mostly at the start of the year they keep changing their policies and requirements.
Yeah, true. Because before we don't need to apply. Is it CGFNS? Right?
Yes. So from last year onwards, I think it's end of September or something. Last year onwards, they change all the requirements and everything, and I think the way to apply to New Zealand Nursing Council is through the CGFNS now.
Yeah.
So basically the CGFNS is verifying all your documents and your experience and everything, and then they forward it to the Nursing Council.
Oh, I see. Yeah, so at least we need to have at least 2 years of experience, right? Or how many hours? I think 2,000.
If I'm not wrong, it's about 2,800 hours.
2,800 or
Yes,
2,500 hours.
One important thing about the experience which I found, because I had to help one of my family to apply to the nursing council. So according to them, you should have an experience of 2,800 hours within the last 5 years from now.
Yeah. I think it's still the same.
Yes.
Yeah.
Yes.
So, when did you start your CAP?
In what year? So
If you don't mind asking.
sure, it's I came over to New Zealand in 2010, where I had to go through a course in addition to the CAP program.
Yeah, IELTS.
Well,
Is it?
at that time, I think it was very hard to find a CAP seat directly. So most of the polytechnics, most of the colleges wanted the overseas nurses to take a course first, integrated with the CAP program.
I see.
So I took a course followed by the CAP program. So they both come together as a 12-month program.
Okay.
So the CAP program was around 3 months.
I see.
And this particular course was like an English for nurses. There was an official name, but basically it's just like an English for nurses course.
I see.
Yes.
Okay. So when you came in here in New Zealand, what are the essential things did you bring?
It depends on which part of the world you come from, actually. So basically, when I came over, it was because I knew it's going to be a bit hard for, as an overseas person, come over to a different culture, different countries to survive. So I basically brought just the usual Asian stuff to start with. So when I found a job like a part-time, I didn't really have to worry much about it because I had a bit of an income. So I mostly bought everything after I came over to New Zealand. So at the end of the day, we could only bring about 35 kilos of stuff from our country on the first flight. So
Yeah, depends on
it has to limit within that. To be honest, I didn't bring any books or anything like that. And
How
very,
about
very,
laptop?
I did bring a laptop here, but after a couple of years, I realized that you have to get a New Zealand or an Australian manufactured laptops or gadgets to survive here because of the warranty issues and the cost of servicing and repairing it. So even though I brought a laptop in, I had to change it to a New Zealand or an Australian manufactured one. Yes.
Okay. So aside from that, any tips to study for the upcoming CAP students?
Well, my simple advice will be just be confident when you come to the CAP program. To be honest, I don't think I have developed my knowledge in nursing through the CAP program, but I have learned a lot how to become a nurse, or it's a big introduction to the nursing point of view in New Zealand. It's totally different from either from India or in Philippines. It's totally different. The culture is totally different. So CAP program is all about just introducing to the New Zealand nursing system.
Yeah, so I think one of the tips will be study about the Maori culture here in New Zealand, right?
Yes, certainly. So cultural safety is a big integral part of nursing in New Zealand. So it is a part of our study as well.
Correct. So tell us how was your experience during CAP? Were you homesick? Were you feeling?
I was a bit homesick initially, but I think after you come over to New Zealand, you would meet a lot of overseas people around, especially if you come to somewhere like Auckland or to the big cities. There will be a lot of people you can find from your own place. So Yeah, I wasn't that homesick, but yeah, it was quite enjoyable. I like it.
Oh, that's good. And did you find a job after the CAP program?
It depends on what visa you come here with. Like when I came over, it was on a student visa, so I didn't have.
Or is it visitor, a student or visitor?
Because I came over with a student visa because of that 12-month program.
I see.
So mostly if you pick just for a CAP program, you'll be coming here as a visitor on a visitor visa. So you won't be able to work anywhere during that period. Whereas if you pick a course and you come over to do a CAP, then you will be eligible to work 20 hours a week. So it wasn't too bad for me to find a job, or for any of us in that batch to find a job, because we had a work visa like for 20 hours. Even it wasn't a student period, but we were eligible to work.
Okay. Do they still have program?
I think they do. They do have it in Christchurch and most of the major cities in Palmerston North, in Auckland, in Wellington.
Okay. So any additional tips for them?
Well, basically, if you want to become a New Zealand registered nurse, you just have to research a little bit more about the New Zealand nursing culture. It's totally different from the one from your home country. So think as a Kiwi, think as a New Zealand registered nurse, and just be confident.
Confident or assertive?
Yes.
Yeah. All right. Yeah. Thank you, Sobin, for your
You're
time.
welcome. Thank you. Bye, guys.
Thank you, Sobin, for your direct and helpful tips about CAP. And now, guys, I'm going to show you the two last interviews I did with my fellow nurses. So one is Karl. He's a Filipino nurse. He's been here in New Zealand for a few years now. He applied his CAP while being here in New Zealand. And then the next one is my sister named Mary. So Mary applied her CAP while she was in the Philippines. So check it out, my interviews with them, and hopefully you'll get some tips regarding with the application for CAP. Hello everyone, so we're going to interview one of the nurses here in New Zealand. So he's a Filipino nurse. So we're going to interview him of how to apply Competency Assessment Program here in New Zealand. So thank you for allowing us, Karl, to interview you in your free time.
I'm very pleased to be part of this interview, Marisol.
Oh, our pleasure. So kindly introduce yourself to our Filipino nurses.
Hi, my name is Karl Enriquez. I've been here in New Zealand for about 5 years now, and I'm currently working in Ashburton Hospital as a registered rehab nurse.
Oh, wow. So, first of all, Karl, why did you choose New Zealand?
Actually, I have never dreamed of going overseas, not even when I was still studying. But I think because I don't want to have a long distance relationship with my girlfriend, I chose to come here. But I have never regret of my decision. People here are really supportive and respectful.
Yeah, true. How did you apply CAP program? What made you realize that, it's time for me to apply CAP?
I first started working as an HCA or healthcare assistant in a rest home, and during that time I was already working out my application for the nursing council by following the guidelines on the website. To cut it short, I first took the English exam, which is the occupational English test.
Okay. So in taking the OAT, you need to at least have B plus score or B at least B?
At least B in all areas so that you can pass the exam.
Aside from OAT, we can also take IELTS, right?
Yes, yes.
So how long did it take for you to process the application?
I think it took me about almost 2 years to process everything because I was also working that time, so it wasn't that easy to process all the requirements.
Yeah, true.
And also I was saving for my tuition too while working.
Yeah, and like getting requirements from the Philippines
Yes.
as well, so it took time.
Yeah, it
Yeah.
did.
Yes. So when did you start your CAP?
We started our CAP program around October 2017 and we completed it December same year.
Okay, so it took more than 2 months, right?
Yes.
So how was your experience during placement?
It was amazing. We had a big class of more than 40 students.
Oh,
It consists I think majority of the class was Filipino students. Some were Nepalese and Indians, but they were great. Yeah, all my classmates were pretty good. I also had some Kiwi classmates too.
so how was your experience during placement?
It was amazing. All my classmates were really supportive. The educator, the instructor, and yeah, teamwork was really great during that time.
Okay, I think probably some of them are competitive as well, right?
Yes, they are, but we always help one another.
Oh, okay, that's good. So, any tips to study while having your CAP? Like particular topics
I guess
they're going to prepare?
I guess you need some adequate sleep, and of course you need to pray always, and then you need to focus during the discussion. Never miss even just a small thing during discussion because it will always help you during the exam. And also always be cautious with medication and fluid calculation. You need to get at least 100% score in order to pass the program.
Okay. So aside from like you need to make sure to get 100% in drug calculations, any other topics to read? Like
Yes, here in New Zealand, you need to have a knowledge about their Treaty of Waitangi.
Treaty of Waitangi.
Yeah, it's about the culture here. So yeah.
All right. So after you did your CAP, did you find a job directly?
Actually, I was really lucky and thankful with my employer when I was still working in the restaurant because they were very supportive. As soon as I finished my CAP program and got my registration as an RN, they immediately offered me a job.
Oh wow, you're lucky.
Yes.
So any additional infos you can share with them, Carl?
I think that's
So
all.
that's all for today. So thank you, Carl, for your time, for allowing us to interview you. Hello, everyone. So let me introduce you to Mary. Actually, she's my sister. So she's also a nurse here in New Zealand. So we're going to ask her some questions during your CAP placement. So Mary, kindly introduce yourself to them first.
Hi everyone, I'm Mary. So I've been here in New Zealand for 2 years now. So I've got my first job in West Coast in rest home for 7 months, and then I transferred in the hospital. So I've been working now for a year in the hospital.
Okay. So first of all, why did you choose New Zealand?
Actually, I'm not sure about it, but since you are already here, so why not try? So here I am now working as an RN.
So you applied your CAP right last 2018.
Yes.
And then since then many things have changed in terms of requirements.
Yes.
And then so how did you apply your CAP?
I applied directly to the Nursing Council of New Zealand, so with your help as well.
Yeah. So at times I was the one who called one of the CAP school applications.
Yes.
Yeah. And then, so how was your experience during your CAP placement?
I had a wonderful experience in my CAP placement. They're all supportive, the RNs there, including the facility manager as well. And tutors, they taught us well in terms of introducing us the Kiwi culture and dementia patients.
And like how to use hoist
Yes.
in transfer.
In transferring, using other equipments like ETACs or steady. So I've learned all about it here in New Zealand. And also other equipments in feeding, like they use a
Kangaroo pump.
yes,
Yeah.
that's
Okay. So, any tips to study?
just study the common diseases for elderly here, like the COPD, pneumonia, stroke, TIA, cellulitis. That's more common here. Pressure injuries.
Yeah.
Yes, they're all common.
As well as the Maori culture.
Yes, Maori culture. They have Treaty of Waitangi here. You should learn about it. Yeah.
Okay. So, after your CAP, I think 6 weeks, right?
Yes, 6 weeks
you
of
had your
CAP.
for about 6 weeks. So, after your CAP, did you get a job directly?
After a month,
Okay.
I waited for my
Annual practice
Annual
certificate.
practice, yeah.
How did you apply?
mostly through online, through websites here like Sick, Indeed, and also through the help of Pinoys here through FB page, referrals.
Yeah. And then if you like to apply in hospital,
Directly.
just search in Google like district health boards.
Yes,
Yeah.
DH.
All right. So any additional info you can share with them?
Just be optimistic and pray, because you will feel homesickness because it's quite far here from the Philippines. So that's it.
All right. Yeah. Thank you, Mary. Hopefully, they can learn something from us.
Yes.
Okay. Yeah. Thank you. Thank you, Carl and Mary, for your time and for sharing your knowledge and ideas about CAP. So hopefully, guys, you'll learn something about how to be a registered nurse here in New Zealand. I'll just summarize the current step-by-step application to the Nursing Council here in New Zealand. So first, you must go to the Nursing Council New Zealand website. So go to the www.nursingcouncil.org.nz and click registration for international nurses. Number 2, you need to read this internationally qualified nurses with other registration or non-Australian before applying so that you will know what to prepare for. So if you are nurse in Australia, you have a different pathway in applying here in New Zealand. I think it's because of the Trans-Tasman mutual recognition between New Zealand and Australia. Number 3, read the 7 nursing standards for registration first to make sure you are qualified to apply. So the 7 nursing standards are identity, English language, current registration, nursing qualifications, post-registration experience, fitness to practice, and the last one is the competent to practice. So the identity, you must prove your identity like having a passport, for instance. And with the English language, so you can take either IELTS or OET. So those are the only English exam as of now approved by the Nursing Council. And with the current registration, you must have been registered or licensed as a nurse in the country where you receive your nursing education, and also hold current registration or license in that or another country. You must also provide verification of good standing from all countries you have been and are registered with. And then the next nursing standard is the nursing qualifications. Your nursing qualification must be comparable to a Bachelor of Nursing degree in New Zealand. So your nursing qualifications will be assessed for comparability with the New Zealand program standards. And then the next one is the post-registration experience. So you must have at least 2 years of experience as a registered nurse. So you must have practiced for at least 2 years in the last 5 years, or no less than 2,500 hours of clinical practice. And then the fitness to practice, you must be able to demonstrate you are fit for registration. You are required to complete a international criminal history check for every country you have lived in for 12 months or more the last 10 years. And then the last one is the competent to practice. So you must be able to demonstrate that you are competent to practice in New Zealand. So many nurses who have been registered overseas will need to successfully complete a Competency Assessment Program, or CAP, before they can grant New Zealand registration. After that, you need to read about the registration process, costs, and frequently asked questions. And then after you've done that, you can start your application. So step 1 in the registration process is that you need to create a CGFNS account. So go to their website, ncnz.cgfns.org, and click Get Started. So this new guideline is just, I think they started this last October 2019. And then, so after creating a CGFNS account, you must complete your profile in the applicant portal, and then apply to the CBS NCNZ and place an order there, and pay the fee for $300 to CGFNS. And then follow the instructions regarding which documents must be submitted to CGFNS for verification. And then once CGFNS has received and authenticated all required documents, CGFNS will provide you with online access to an applicant copy of your credentials verification service report. So you will have 30 days to review the report and approve it to be sent by CGFNS to the Nursing Council New Zealand. And then you will then have a further 30 days to apply to the NCNZ after your report is received by them. Step 2, so request CGFNS to send your report to the Nursing Council. And then step 3 is that you must apply to the Nursing Council, find a CAP school from the accredited list. So you can find the accredited CAP schools in the Nursing Council website. And then after that, you must receive a CAP letter, and then pay for enrollment, and then accommodation if it's offered in the CAP school. And then after that, you must have undergo a medical exam, and then apply a visit visa application if you're outside New Zealand, or no sponsorship from a partner. You must wait for the visa approval from the Immigration New Zealand, and then after visa approval, your CAP school will send a reminder to you to get international criminal history check. And then after that, you can buy tickets to New Zealand. I think no need to purchase a two-way ticket. You can just buy one-way ticket to New Zealand. You can then start your CAP school course for about 6 to 12 weeks. And then the last one, after you've successfully completed your CAP course, you are then registered. You will be asked to apply for an annual practicing certificate. So this entitles you to practice as a nurse in New Zealand. Congratulations! if you have any questions, just comment down below and we will try to answer your questions. Hopefully, you'll be more successful in your nursing career. Thank you.